gave them that. Of course, I gave them the products of the company because I was not allowed to prescribe synthetic medications. Okay, but really, when I saw the results, I told myself, okay, cardiovascular diseases are really so common, and majority of which are secondary to what? Free radicals. Now, doctor, so what do we need to do in order to fight or neutralize the free radicals? Well, I'm sure you know these words. My dear leaders, we need antioxidants. Okay? And these are the words that we need to know as great leaders of Alliance in Motion Global. Free radicals will harm your body, and to save your body against free radicals, we need antioxidants. Very good. So try to mention the words again and again in order for you to memorize the words. Okay, antioxidants. So where can we get them? Majority of which will be derived from fruits and vegetables. I'm gonna mention to you the amount. According to World Health Organization, we need to eat 5 servings of different colors of fruits and vegetables, at least 400 grams in one day. Are we together? Okay, good. Now, doctor, what will be the benefits of antioxidants? Well, this will be it. They will be there to supply the lost electron to the free radicals in order to neutralize. Again, say the words in your mind, neutralize. Okay? The free radicals in order for your cells to become healthy. And if you would like to fight different kinds of diseases, then you must be healthy. You must have enough antioxidants, okay, to sustain your bodily functions. Now, doctor, what if I'm not fond of eating fruits and vegetables? Okay, because the requirements is still 400 grams per day. Then here comes the significance of supplementation. Can you say the words again? Supplementation? Good. What is the meaning of supplementation? They will be there to bridge. The word is bridge the nutritional gap between the food we're eating and the supplements that we will be taking. And every time we talk about the best food supplements, okay, in Nigeria, then these are the wonderful food supplements of Alliance in Motion Global. Okay, I'm gonna give emphasis on the ones available, okay, presently. But I would like to assure you the best of the best will still be C24/7. Okay, the best of the best will still be C24/7. Now, if you're looking for a product that contains everything, my word is everything. Okay, it's right there, C24/7. From 22,000 phytonutrients to 29 vitamins and minerals that we've been taking since we're a baby, 18 amino acids for the building blocks of proteins, 14 super green foods period in a blend, the 12 fruits and 12 vegetables more than the requirements given by the WHO, the mushrooms that has the antioxidant, anti-cancer, antibacteria, antiviral, antifungal, okay, the digestive enzymes to metabolize food to become energy, your herbs and specialty nutrients, and of course, the 10 essential omega fatty acid to help normalize your blood cholesterol. Okay, it's right there. But Mama Grace knows this, okay? Because from these 29 vitamins up to the 10 essential omega fatty acids, well, I would like to inform you, my dear leaders, that those were the components of our former flagship product called as Complete Phyto Energizer. By the way, I would like to inform you, the yellow and the green is just the same. Okay, this is for the Philippine use, and the green is for the international usage. Okay, but it's just the same. Okay, now, so Doc, you mean to say that everything incomplete are also part of C24/7? Yes. Now, Dr. Kabantog and of course the board of directors added the 5 anti-aging and for longevity polyphenols to C24/7. And because of which we now have the exclusivity and patent. This we ought to know. Mean to say that only us, the leaders of AIM Global Worldwide, are the ones allowed to sell, promote, and network C24/7 worldwide. Wow. okay, because of the exclusivity and patent of AIM Global Distributors, okay, to C24/7. Perfect. And I would like to inform you that year 2016, our very own product C24/7 was also awarded as the number one food supplement in the world. And you know what I was able to present to you year 2015 by comparing our C24/7 product with other food supplements available in Nigeria, that we have the highest ORAC value. Okay, when you talk about food supplements. Now, Doc, you said that we will be discussing the algorithm, not much on the components. Well, let's go straight to the point. Get ready with your camera, take a snap of the slides, and this will be the algorithm. There you go. Now, my dear leaders, this is the most important part. So kindly focus on this topic. The best time to take the product will be 30 minutes before mealtime or 2 hours after meals. What again? 30 minutes before mealtime or 2 hours after meals. Wow, that's good. To simplify it, empty stomach. Why again? For faster and better absorption of our wonderful products. Faster and better absorption. If you're gonna look at the slide, there are different colors: green, red, and black. Different rows and, of course, columns. Why? Representing breakfast, lunch, and dinner time. Okay? Now, this is it. Irregardless of the situation, either they are normal, suffering from other diseases, or suffering from cancer, we will always begin and start with once a day. Why again? For you to avoid suffering much from the so-called healing crisis. What is the healing crisis? The time wherein we will manifest signs and symptoms of a hidden illness inside the body. Like what? Headache, dizziness, sleepiness, abdominal pain, LBM, itchiness. Those will be the healing crisis. Okay? And different individuals will react differently to a certain product. But don't worry. After the healing crisis, which some of us may manifest, follows the so-called detoxification process. We will detox. We will now be adjusting with the products of the company. You get the idea? So again, to lessen the so-called adverse reactions to your body, just begin with once a day. Are we together? Okay, good. Now, what else? After 1 week, make it 2 times a day. So we're only supposed to adjust every week. Okay? And on the third week, then that will be the 1, 1, 1 or the 3 times a day. That's so simple. Now, I would like to inform you that there are certain situations or circumstances, okay, wherein the maximum dosage will only be 1, 1, 1 or 3 times a day. Again, get ready with your cameras and take a snap of this one. Okay? 1, 1, 1, maximum dosage for our products, either C24/7 or complete Phyto Energizer. Now, my dear leaders, I would like to inform you, okay, if you're normal, if you're healthy, the best product will still be C24/7. Very simple. If we are normal, we are healthy, the best product will still be C24/7. Okay, now, if by chance you are suffering from kidney diseases, liver diseases, goiter or enlargement of the thyroid glands, or autoimmune diseases, wherein your own immune system is destroying your own body, then the best product for that, I would like to inform you, will be complete Phyto Energizer. Okay, kidney, liver, goiter, autoimmune. What's the product again? Complete. Okay, now, doctor, why? I'm gonna make this simple to all of you. Our kidneys are producing hormones that can stimulate the bone marrow to produce red blood cells. If your kidneys are suffering from end-stage renal disease and cirrhosis for the liver, which means they are said to be irreversible, okay, then the amount of hormones that will be produced will go down, and the stimulation of the bone marrow will become so weak, and the amount of red blood cells that will be produced will be insufficient. Meaning to say, you may suffer from anemia. Now, my dear leaders, as a doctor for the past 24 years, I have patients under my care who are suffering from anemia that are also suffering from a very low platelet count. Platelets. What will be the significance of the platelets? Well, I would like to clarify to you the issue. Okay? They are the ones that will try to initiate blood clotting if you're suffering from bleeding to stop the bleeding. For example, you were cut by a very sharp knife and you started bleeding. In order to stop that bleeding, we need blood clotting that will be initiated by the platelets. You get me? Okay, doc. Now, what if you will give products of the company with resveratrol that are present there in Nigeria, like C24/7, Life, and Vitamax? Remember this, resveratrol products has a blood thinning effect. So if you will give a product with a blood thinning effect to your clients, okay, to your clients who are anemic with a low platelet count, then you're trying to increase the possibility that they may suffer from bleeding. So you're putting them at risk to possibly suffer from bleeding. So again, my dear leaders, to make it simple, if we will be dealing with kidney problems and liver problems, then just give complete. What will be your dosage? Maximum 111. Okay? Including those suffering from goiter, either hyperthyroid or hypothyroid. To avoid confusion, just give complete. And also autoimmune. Your own immune system is destroying your own body, like lupus, then just give complete. Clear? Now, doc, how do we give it properly? You need to monitor the creatinine and SGPT. Okay? Do you use it? Initially give once a day. If the creatinine is said to be improving, the condition is improving, then increase it on the second week to 2 times a day. If after some time again it improves, then we can now give it 3 times a day or 111. You get me? But please, the maximum dosage will only be 111. Okay, why again? The elimination of the excess of the products will happen to your kidney, and the metabolism of everything that we will be taking will be happening from the liver. If the liver or the kidneys are totally damaged and you increase the dosage to 211 or even 333, then you are possibly doing more harm than good to your clients. So, to simplify everything, as long as we are dealing with the liver and kidney problems, what will be your maximum dosage for that? 111. Clear so far? Okay, good. Now, doctor, I got a point. Okay, I got the point. Now, this is it. Okay. For other diseases like hypertension, diabetes, heart attack, stroke, okay, then you can now increase your dosage to 222. Either you give them C24/7 or complete. And my dear leaders of AIM Global Nigeria especially, okay, The only time wherein we will give the mega dose. Can you say the word mega dose? Okay, that will be your 333 is if we are dealing with cancer clients. Cancer clients. Are we together? Are we clear with that one? Very good. So let me repeat. Normal clients, 111. Other diseases, 222. Cancer, megadose, 333. Now, listen to this one. Even if you are suffering from other diseases or even cancer, if at the same time, the word is at the same time, you're also suffering from these kinds of problems, kidney, liver, goiter, autoimmune. Instead of us giving the 222 or 333, we will again go back to 111. What again? Listen, look at this again. Even if you're suffering from other diseases or even cancer, wherein the dosage supposedly should be 222 or 333, if you are suffering from kidney disease, liver disease, goiter, autoimmune, again, we have no other choice but to give a maximum of 111. Clear? Okay. So simple. Now, there will also be some other situations wherein, okay, we need to avoid resveratrol. That will be the special precautions like Restore Life, C2FER, or Vidamax. When will this be? Pregnant ladies or those ladies who are breastfeeding mother. Okay, why? Even up to now, after reading so many articles, more than 100 so far, about resveratrol, not even a single study are saying, okay, that resveratrol is safe to the fetus during pregnancy, and to the infant while breastfeeding. So, for us doctors, if there will be no clinical studies that can prove the safety of the product, then by all means, don't give it. Don't give resveratrol. So again, for those kinds of ladies, pregnant, breastfeeding, you go for complete. You get me? Now, what else? If you're taking blood thinning synthetic medications, aspirin, heparin, warfarin, coumadin, clopidogrel. Let me repeat. Aspirin, heparin, warfarin, coumadin, clopidogrel. Why? They said it is not a good idea if we will combine a blood thinning synthetic medicines like this and a blood thinning herbal products that contains resveratrol. Why again? We're trying to put them at risk again to possibly suffer from bleeding. So just avoid resveratrol for these kinds of medications. Number 4, if a lady is suffering from cancer or non-cancerous tumor of the female reproductive systems like what? The breast, the ovary, fallopian tube, cervix, uterus, vagina. Why again? Because of the so-called plant-based estrogen effect. Dr. Y, ladies, we all know that you have a high level of estrogen, while we the guys we have a high level of testosterone. And according to medical studies, if you will further increase the level of estrogen for the ladies, you're pushing them to suffer from cancer of the reproductive organs. To simplify again, I like this word, to simplify. If your grandmother, your mom, your auntie, or your sister have suffered or are still suffering from cancer of their reproductive organs, then please don't just give resveratrol. You may give complete. And finally, number 5, for those suffering from bleeding or bleeding tendencies, okay, bleeding of the what? Bleeding of the nose, mouth, bleeding stomach, bleeding intestines, bleeding pile on your anus, and of course, bleeding fibroids or bleeding vagina. Okay? Avoid giving resveratrol. Just give complete phyto energizer. Also, if you're suffering from leukemia, anemia, dengue, yellow fever, Don't give resveratrol products. Give complete phyto energizer. So let's try to recall and summarize the two slides. Kidney problems, liver problems, goiter, autoimmune, pregnant ladies, breastfeeding mom, taking blood thinning synthetic medications, having problems of the female reproductive organs, or those with bleeding or bleeding tendencies, the best product that we can recommend for them will be what again? Complete Phyto Energizer. There you go. Okay. So simple, right? Now, again, take a picture, take a snap. Let me drink my water first. Okay. Very good. Game. Let me remove my glasses first. Okay. Now, this is it. Anywhere you go, there will be pregnant or lactating moms. Anywhere you go. And amongst the products available in your country, these are the safest products that we can recommend for pregnant ladies. Complete My Choco Colidus. So kindly wait for the My Choco to be available, but these are the three products that I will be suggesting. Don't give the resveratrol products. Don't give the leave and coffee. Don't give the burn products. These will be the three safest products of the company that we can recommend for your pregnant ladies. Now, complete My Choco. You can take it anytime. But the best time to take the two products is on the 11th week of pregnancy. Why again? Because during the first 10 weeks, it's what we call as the so-called organogenesis stage, wherein the embryo or the zygote are just starting, the word is starting to form their organs. And our herbal products might affect the organ formation. You get me? Now, on the 11th week onwards, it's already a fetus wherein the organs are complete and it is now safe to give our products until she gives birth. For Colidus, it is relatively safe. Again, once it's available, mhm, you have to grab, okay, this product Colidus. Why again? Okay, first 10 weeks of pregnancy, safe. But please, on the 37th week of pregnancy, this is my advice. You have to stop taking Colidus for the time being. Why? Because during that time, a lady client may now give birth. And we all know what's happening while you're trying to deliver the baby and the placenta. Gush. Remember this. Blood will be gushing out. And we don't want that to happen. Remember, Colidus is a little blood thinning effect, right? And it might intensify or make the bleeding worse. Of course, for a mom giving birth, we don't want that. Okay? So please, avoid giving Colidus or stop giving Colidus on the 37th week of pregnancy or when the mom is about to give birth. You get me? Now, doc, they said that Colidus contains DHA, good for the brain, and the baby needs it through breastfeeding. When can the mother resume taking Colidus product? Well, as long as the bleeding stops. Then most of the time it will happen on the second, third day, or fourth day. As long as the bleeding stops, then mom, you can now resume taking the product Colidus. Okay? Now, these three products for a pregnant or lactating mom should only be taken once a day. Only once a day. You get me? Now, majority of our clients will fall under the category of cardiovascular diseases. Cardio means the heart, vascular means the blood vessels, and when you talk about diseases, again, heart attack for the heart, stroke for the brain, hypertension for your blood vessels, kindly include diabetes, hypercholesterol. Okay? So the simple question will be, are they taking blood thinning synthetic medicines or not? What again? Are they taking blood thinning synthetic medicines or not? Well, what kind of blood thinning synthetic medicines? Let's try to review. Aspirin, heparin, warfarin, coumadin, clopidogrel. My dear leaders, this is it. If they're taking blood thinning synthetic medicines, these will be the two products that I can recommend for you. Complete and Colidus. How much for complete? Diseases? 222. But again, started once a day. But for Colidus, just give it only once a day. Why? Because again, it has a blood thinning effect, but once a day is relatively safe. But if they are not taking blood thinning synthetic medicines, my dear leaders, you can now go for a combination of what? C24 Restore Life Colidus. Now, I'm going to give you a scenario. Dr. Villena, I have a client suffering from diabetes. Is he taking blood thinning synthetic medicines? No, he's only taking medications for diabetes. If he can only afford a single product, then I will prefer Restore Life. Insulin sensitivity, they will help normalize your blood sugar that is said to be needed, okay, for those suffering from diabetes. If he would like to add another product, you can go for Colidus. If he can afford three products, then you add C24/7. That should be it. You get me? Now, doc, I got a point. I got a point. So these are the products that I can recommend if they're taking blood thinning synthetic medications or not. Now, doc, you've already explained C24/7 and complete. How about Restore Life? Okay. Well, once a day, maximum 2 times a day. How about Colidus? If it's already available, let me try to simplify this. Have a blood cholesterol checkup every year if you're 30 years old and above. Okay. If it's more than 150, that will be normal. More than 200 and more than 250, that will be abnormal. If you have abnormal counts, you have to repeat the test every 2 months. And your Colidus dosage will depend on the amount of cholesterol. Now, if it is again abnormal count, for example, 250, you need to repeat the test every 2 months. So from 250, it became 200, bring it down to 2 times a day. But if by chance it's already less than 200 but more than 150, that's normal. So just take Colidus once a day, but this time during mealtime. Can you say the word during meals? Okay. Why? If you will eat a fatty meal rich in cholesterol, the excess cholesterol, if it goes inside your intestines, and at the same time you've taken Colidus while eating, this omega supreme fatty acid that contains DHA and EPA will try to pull the cholesterol and bring it out to your feces waste. You will just defecate or poops the excess cholesterol. You get me? That's why the best time to take it is during mealtime. And the meaning of Colidus is cholesterol reducer. Cholesterol reducer. Are we together? Okay, very good. Now, Doc, I got a point. I got a point. That's good. And here are the other products of the company. Okay, so let me remind you, C24/7 will be the best. Complete is our former flagship product. We started with Complete way back 2006. Okay, 16,000 phytonutrients, while C24/7 contains 22,000, meaning to say that C247 is better than Complete by 6,000 phytonutrients. Wow! And I would like to inform you that all of the components of Complete are part of C24/7. Now, some people may ask you, Sir, Ma'am, upline, what is the need for Complete if it's already in C24/7? Well, let's try to recall. If you're pregnant, breastfeeding, suffering from cancer or non-cancer of the female reproductive organs, suffering from bleeding or bleeding tendencies, taking blood thinning synthetic medications. Okay, what else? If you have a kidney or liver problems, goiter, and autoimmune disease. So for those kinds of clients, you go for Complete. But for other diseases, you go for C24/7. Okay, get me? Get me? Okay, good. Now, Restore Life, Restore Life. Okay, it's wonderful. When you talk about Restore Life, It means restore your life. Colidus, cholesterol reducer. Restore life, restore your life. You get me? Okay, now, Doc, they said that it can prolong our lives. Yes, because of DNA repair proven medically, it can prolong our lives by more than 30%. And if you're gonna ask me, I need that. I want to reach the age of 80. And that will be the advantage of taking Restore Life or resveratrol. Now, Doc, it contains resveratrol and for longevity polyphenols. What will be the effects? Remember this, okay? It can help break down your fats to become energy. A wonderful product that you can combine with Burn Slim product. What else, doctor? Can help normalize your blood sugar for those suffering from diabetes. Can help normalize your blood cholesterol. This product is very good for your nervous system, the brain, spinal cord, and of course even the nerves. And with a high level of antioxidants, anti-cancer properties. Clear so far? Good. Now, my dear leaders, listen to this. Let me make it simple. All of the components of Restore Life for longevity polyphenols with 5 anti-aging plus everything incomplete were added up to finally come out with the best food supplement in the world, and that is C24/7 of Alliance in Motion Global. Perfect. Okay, now, if we will take care of our body, you need to take care of the body of your young kids to fight against what? COVID-19 and for other diseases. And the best product for them, number one, will be Kiddy 24/7, Nutragamis. This is the counterpart of C24/7 or complete for young kids. Okay? Number one, they will enjoy the taste. Why? It's just like eating gummies or gummy bears. But everything used are all natural. I was able to see the reaction of Mr. Jobs when I say gummy bears. Okay? He was nodding his head. Okay? Is that was that Haribon? Jobs, the one that we bought? The Haribon gummies? The cola flavor? Remember that one? Okay? At ShopRite? That's Haribon. Okay? Haribon gummies. Okay? So these are also gummies, but everything used on this product are said to be natural, organic. Doc, that's wonderful. Yes. Next, it contains 14 vitamins and minerals and 26 fruits and vegetables. I know what you're thinking, doctor. You just mentioned earlier that C24/7 contains 12 fruits and 12 vegetables, all in all 24. While this one contains 26. Why? Because some of the kids are not fond of eating vegetables, especially that are needed by the body. So to compensate with the loss of the kids, when you talk about fruits and vegetables, our company increased the components to 26 to compensate. You get me? Now, Doc, I got a point. Now, if you would like your kids to have a sharper mind while studying, while attending school, then you give a product that contains DHA, and that product is, of course, My Choco. Aside from Colidus, this is the second product of the company that contains docosahexanoic hexanoic acid. Doc, I got a point. It will improve your brain memory. Definitely yes. Again, let me drink my water first. Now, let me try to simplify both Live and Coffee and My Choco. Both of them are alkaline based, safe for your stomach. And both of them are herbal beverages. Why? Because 1/3 of the milligrams of complete were both added to My Choco and Live and Coffee Burn. Or Live and Coffee, should I say? Doc, that's good. Okay? You have the original, the latte, cappuccino, and of course sugar free. I've heard that the ones available is the latte and the sugar free. Am I right with that one, Brother Japs? Okay.
Yes. Yes, doc.
Oh, very good. Very good. So I know you love cappuccino. I've been there for 5 consecutive years. Okay. But let me try to remind you again, if you are age 30 years old and above, The ones I will be preferring will be the sugar-free that is available in your country. Maximize the sugar-free. Why? Number one, you will enjoy the taste. It tastes so good. Why? Because of stevia. What is stevia? Organic, natural, but 300 times sweeter than sugar. It's not a sugar, but sweeter than sugar. That's why you will enjoy the taste. What else? No sugar. That's why you can give this to your diabetic clients. Safe. Okay. Next, can help normalize your blood pressure with antibacterial properties. Can help stimulate calcium production to strengthen your bones. And finally, with a high level of antioxidants, anti-cancer properties. Wow. And again, you will enjoy the taste. Why? Aside from stevia, this leaven coffee also has coffee arabica, which is a world-class coffee, and also less caffeine, not enough to speed up the heart rate. And this will be your beverages, okay, that you can safely give to your clients. Now, before you further continue with other products, when is the best time to take the products? Get your ball pen, get your paper, write this down. 1 year old and above, my choco. Less than 1 year old, no products yet. But for 1 year old and above, give my choco once a day. 2 years old and above, especially if the child can swallow the food and chew the food very well, then you can start with Kidney 24/7. If you're in doubt with their swallowing capabilities, you can cut it thinly and give it slowly, one at a time, to your child. Now, doctor, my client, my child, wants to take it 2 times a day. Well, at the age of 6, you can give in 2 times a day of the Nutragamis Kidney 24/7. And at the age of 9, if you want, you can give them a maximum of 111 or 3 times a day of Kidney 24/7. But for me, once a day is good enough. Now, if your child is already 12 years old, then that's the time for you to give him complete Phyto Energizer and even Colidus once a day. Okay? And for the rest of the products, resveratrol like Restor Life, Vidamax, C24/7, Live and Coffee, Burn Products, Burn Slim, then please give it at the age of 18. Let me repeat what I've said. Less than one, no products yet. 1 year old and above, my choco. 2 years old and above, Kiddy 24/7. 12 years old and above, complete and or Colidus. And for 18 years old and above, the rest of the products, resveratrol, Live and Coffee, Burn Products. Clear so far? Okay, good. So simple. Now next, Vidamax. What is the beauty of Vidamax? It contains Resvida. What is Resvida again? Transresveratrol. I know what you're thinking, Doc. You've just mentioned that earlier in Restore Life. Yes. That's why majority of the effects of Restore Life are also present in this product, Vidamax. Okay. Number one, okay, it will try to dilate the blood vessels, widen the lumen in order to help normalize your blood pressure. So this will be a good combination to those having a blood uh, a hypertensive medication, okay, or a medicine that will help normalize your blood pressure. So this will be a good supplement to help normalize your blood pressure. Next, it will also increase your metabolism, break down the fats to become energy. Okay, what else? Helps normalize your blood sugar and blood cholesterol, good for your nervous system. But remember this, it has a bonus. What is that? Say this word, fruit flow. Okay. What is fruit flow? It will help prevent abnormal clotting. Thus will help prevent heart attack and even stroke. And that is Vitamax for you. What will be your dosage? Once a day. Once a day is good enough because that product can last in your body for 18 long hours. Good. Now what else? Burn Slim. Um, when I was in Nigeria, some of my friends, some of the leaders have mentioned to me that there's an old saying or culture in Nigeria that big is beautiful. Okay, that was what other people are saying way back then. But again, as your medical doctor, I would like to be honest. If you are so fat, if you're obese, okay, what can possibly happen to you? Heart attack, stroke, diabetes, and so on and so forth. Now listen. According to experts studying COVID-19, if you will be exposed to those with COVID-19 and you were able to acquire the virus, if by chance you're suffering from other diseases, then the likelihood that you may suffer from a high risk or a critical kind of COVID-19. But if you're healthy, okay, not suffering from any kinds of diseases, even if you will be exposed to COVID-19, I do hope not. But if you will acquire them, you might only be categorized as the asymptomatic or the mild cases. So, doc, this is good. Yes, it will help you break down the fats. That's why it's called body under right nutrition. So, what are we going to do, doc? Take the product 30 minutes before mealtime. Why? In order for the fats not to be absorbed by the body, for you to just defecate the fats. That's number one. Number two, exercise 3 times a week, 30 minutes per exercise. Why again? To break down sugar and the fats at the same time so that losing weight will become easier. Next, diet. Doctor, that's the problem. That's why we're so big because we are fond of eating too much food. These burn slim products has an appetite suppressant, meaning to say the amount of food that you will be eating will become lesser. And that will be a good news. And finally, of course, lots of water. So let's try to repeat. Take the burn products, exercise, diet, lots of water, positive mindset, and I will assure you, you will lose weight. Doctor, up to how much burn slim capsule can I take since the other burn products are not yet available in Nigeria? Well, you can go as much as 3 times a day. 30 minutes before breakfast, 30 minutes before lunchtime, and 30 minutes before bedtime. Okay? And follow what I've mentioned earlier, and I will assure you, you will lose weight. Clear so far? Okay, good. Now, Doc, that's very good. What else? This is it. Okay, this is it. Okay. I have here the black, and of course, the gold one. Okay, the Eye Protect 24/7 with the energy necklace. Okay, let us try to discuss first Eye Protect 24/7. Well, my dear leaders, this is the Eye Protect 24/7, the ones inside. Okay, let me show this one to you. This is the Eye Protect 24/7. It contains chlorine dioxide. So say the words chlorine dioxide. According to medical studies done worldwide, in a laboratory, even in the hospital, even in hospice care, in a wet environment, they place different kinds of bacteria, viruses, and fungi. When they place the chlorine dioxide, you know what happened? Within seconds to minutes, okay, they died. Why? Because of the chlorine dioxide. Okay, so doctor, they place it here. They place the chlorine dioxide inside. It's right here. Doc, that's so wonderful. Yeah, because this will give you an airborne protection. What again? Airborne protection. 6 feet radius surrounding you, okay, of chlorine dioxide against airborne diseases. Doc, they said that COVID-19 is through droplets. Yes, okay. But remember, we're not just fighting COVID-19, we're also fighting different kinds of diseases like what? Tuberculosis, flu, and so on and so forth. So, use your imagination. You're standing in one corner of the room, then suddenly there's this guy without a cough etiquette that suddenly cough or sneeze. If they will cough or sneeze without you seeing it, microorganisms will travel for as far as 20 feet. Wow! But if you're wearing the eye protect 24/7, once the microorganisms goes inside your green zone, it will dissolve, it will disintegrate, it will die right away. And that is the beauty of eye protect 24/7. Doctor, I'm already taking C 24/7. Good. That will be your internal protection. While the eye protect 24/7 will be for your external protection. As a medical doctor, remember this. What I always say is that the more protection you have right now, the better for your body. The more protection you have right now, the better for your body. Clear? And because of the sustained release technology, that product may last for 1 month. After 1 month, replace, replenish. Diaprotect Home, I do hope it will. Is it already available there, Jobs? Diaprotect Home, not yet. Okay, but if and ever it will be available, just place it on the wall
Yes.
inside your room. Ah, very good. Inside your child's room, and even inside your cars. Why? To kill the microorganisms on those places. And again, just like I protect 24/7, it will also last for 1 month. Now, we have two kinds of energy. I'm gonna get my other one. We have the energy pendant, this, and the energy diffuser, which is your newest product in Nigeria. Let's talk about this first, okay? Because of infusion process, okay, through plasma-based generator system, this, once you wear it, will stimulate your subtle energy or your electromagnetic energy inside your body. Once you strengthen, okay, your electromagnetic energy or your chi, or your inner energy, it will also try to strengthen your aural field that will be surrounding your body. Once you strengthen your aural field, it will give you a protection against UV light or radiation coming from sunlight. That's good. And while you're trying to stimulate your electromagnetic energy, okay, it will number one, speed up your metabolism, and number two, strengthen your immune system. The additional protection, and that will be lifetime. Okay, now for your gadgets, can you say the word gadgets? Like what? Cell phone, tablet, laptop, okay, appliances, television, okay, refrigerators, those stuff. Put this, put this, place this on your gadgets and appliances. You can Google this in the internet. Some of your brothers in Nigeria have tried this. They bought an electromagnetic frequency device, and when they monitor their devices and even gadgets, they saw that the radiation went up. But when they placed the energy diffuser, it went back to zero. Wow! And since we are now in this world called as virtual reality, wherein we are always exposed to the radiation of the cell phone, of your tablet or laptop, protect your body. Place the energy diffuser, just like this one, in order to lessen the amount of radiation that will hit your body. Doctor, what if it was removed? Don't worry. According to Dr. Kabantog, just attach it back. Why? Because the anti-radiation effect of energy diffuser is also lifetime. Wonderful. Now, last product. I'm sure some of you have suffered, or should I say all of you, not some, have suffered from muscle pain, right? And some of you may take the so-called pain relievers like celecoxib, meloxicam, diclofenac sodium, Mefenamic acid. Okay. Those are the so-called anti-inflammatory products. Okay. But again, do not abuse these products. Do not abuse from a doctor. And if you talk about coming from a doctor, good news. Why? Because the one in front of you is a medical doctor. Okay? Now, why should we try to avoid using too much pain relievers? Because number one, they can totally damage your kidneys. And number two, okay, it may also cause ulcerations. So please, if I were you, I'll go for natural means. This is a natural means of trying to what? Get rid of those so-called pain, muscle pains on your body. Okay, now it contains 9 components, 9 natural components. Okay, so take a bath first, dry up your skin, then apply the patch evenly on the muscle of the body suffering from a certain pain. Because of the warmness of this product, soothing heat relief, at once it will try to what? Relax the muscle. That alone will start relieving, okay, the so-called muscle pain. Next, okay, it will try to what? Okay, widen the lumen of the blood vessels for the swelling to go inside. Doctor, so what will happen? Once the inflammation, okay, goes inside, then the swelling on that part, okay, will be minimized. And sometimes after 3 hours or 6 or 12 hours, the pain is no longer there. Even if the pain goes beyond 24 hours, don't worry why, because this patch can last on your body, can attach to your skin for 48 hours. Wow! But I have a simple favor to ask each and everyone. After 48 hours while taking a bath, then remove the patch slowly. Why again? Okay, to avoid irritation. If by chance the pain is still there, then apply another patch. Okay? And I will assure you, these are wonderful products of the company. These are, of course, your products. These are, of course, your products. Your wonderful products. Okay? Of course, my Facebook page, kindly like it. For Brother Jobs, if they have certain questions in mind that they would like to ask, we're now open for the question and answer portion. Thank you very much.
All
Okay?
right. Thank you so
That's it.
much,
That's it.
Doc Boots.
Okay, very good.
That wonderful discussion, and of course, it's in detail. And I'm sure everyone is excited to earn from their ed plan, especially in UPP. And we know if you want to earn in UPP, your uni level, and from your stair steps, all we need to do is to learn from our products how we are going to share this. Okay, and if you want to maximize it, not only by sharing, you should also use it, because by using our product regularly, of course, you can be a testimony on that. It's very easy for you to share and explain the products to your client.
Definitely. It's good.
Yes.
Just like
Oh,
Mama Grace, I guess Mama Grace is starting to see the result of the UPP on her DTC.
yes, yes, yes.
Yes.
All
Am
right.
I
So
right,
to,
Mama Grace? Okay. Oh, you look at the smile of Mama Grace. Oh, you can see now the result of the UPP. I will assure you,
let's
Mama Grace, you will really enjoy it. Okay. You will enjoy
yes,
the outcome of the so-called EdPlan 2.0. Okay. Because that UPP is something else.
yes. All right. We have our first question here. It's a very common question.
Okay.
More, what products is best for arthritis from
Arthritis.
Onos?
Um, there are different kinds of inflammation or different kinds of arthritis. Namely, osteoarthritis is the so-called wear and tear. We have the rheumatoid arthritis as autoimmune, and we have the gouty arthritis secondary to what? High uric acid. But regardless, aside from the pain medications given by the doctors, okay, we can recommend 3 products. Number one will be Colidus. because omega fatty acid is said to be good for your joints. Second will be Restore Life or Vidamax. Why? To dilate the blood vessels so that the swelling from the surroundings will go inside. Okay. And number three will be, of course, either C10% or complete because of the presence of vitamin B complex. And those two products also have so-called anti-inflammatory effect or anti-swelling effect. So I can recommend to you three products. Okay. Colidus, Restore Life, C247 are complete. Okay. What else?
All right. Okay. Anyway, Doc, we are also live in group page of In
Oh, that's
Nigeria
good.
Talks.
That's good. That's good. And I know this is recorded, right, Japs?
Yes, yes, Doc.
Our
And
dear listeners may be able to go back and watch for you to be able to practice and
yes,
memorize
definitely.
the algorithm, especially. Okay.
Uh, there's a question here from our live. What is the maximum? What is this? Maximum dosage of complete with a spleen problem. Spleen.
Oh,
Yeah.
spleen. Oh my. Um, what happened? Was it injured? Does it
All right.
is there a
I will ask
trauma
you
or
first.
cancer?
Yeah,
So
let me go back to that person. I will ask the
um,
person first.
while we're
But
waiting for the
yes,
response of our brother, okay, or sister who asked the question, well, you can only give complete at a very low dose. When I say low dose, that's 111. But always begin with once a day. Every week you add one until you reach 111 for those suffering from spleen problems. But I do hope, okay, the brother will be able to show us the specific diagnosis, the laboratories, and also the medications being taken by the client. Okay.
okay. Thank you, Doc. We also have a question from Josel, Team Moscow, Russia, I think. Hello, Doc. What products should give for the kid 5 years old suffering for acute lymphoblastic leukemia?
Oh my, leukemia for a young child.
Five
Okay,
years old.
so there will only be two products that we will be able to recommend. Once a day of kidney and once a day of my choco. Only those two products. Okay.
KD and
If by
Mike.
chance you have the Ultra H2, just like Mama Grace, when she went to the Philippines, I guess she has the Ultra H2. If by chance you have the Ultra H2, then you can let your child drink it.
Yeah.
Okay, the Ultra H2.
Hope we can
That will
have
also be
Ultra
wonderful.
H2 here.
But of
There's
course, the top feeders were able to purchase the Ultra H2
yes.
when they had their Philippine trip promo 2019, if I'm not mistaken. Okay,
Right.
and I'm sure Mama Grace was able to enjoy the products. Okay, so that will be
Uh,
good for those suffering from leukemia for young kids. Okay.
all right. Doc, going back to the spleen issue,
Uh-huh.
suffering from growth on the spleen.
When you talk about growth, are you talking about cancer?
Uh,
Irregardless, the spleen also is responsible one way or the other for blood. Okay,
no
so
medication for now. He
okay,
said,
so just go for complete,
right. So
and
B.
the maximum will be
Elvester,
three days.
go for complete.
Yeah.
And while we are waiting for other questions, let take this chance to announce that by next week, all regional centers, the seminar hall are already open for
Ooh.
our, okay?
Okay,
So,
but
but take note
brother,
on this.
let's try to remind the leaders. Still
Yeah,
try to observe social distancing.
yes.
We'll highly appreciate if you will
Distance.
be wearing your mask and of course your face shield, just like
Yeah,
what I've been doing every time I step out of my house. I
face
always
shield.
have a couple face
Yes.
shield and the disposable mask. Okay,
All right.
protect your
That's
body.
it.
Okay, I know you have a very strong body. I was able to witness that for 5 years. But remember, this virus is something else. Okay,
Yes,
so protect your
definitely
body.
it's true.
We would like you to be healthy, of course. And there's a saying that prevention is better than cure. We have wonderful products, but
Yeah.
still, Prevention is better than cure. Bring your alcohol with you or your hand sanitizers. I'm sure the company will be providing alcohol once you go inside the office. Okay, so I'm sure our country managers are discussing this because we would like you to be safe in entering the branches of our company in Nigeria, especially. Okay.
Yes. All right. Once again, don't forget your masks, your face shields, and of course, observe social distancing. I
What
know
what
you're already excited for how many
yep.
months?
What day will it be opening? The
Monday.
branch?
I think it will be
Monday.
Monday.
Wow.
But
So
supposedly today. But of course, we just only announced it by the government around 2 days ago or
okay.
Thursday or Friday. That's why we
So
oh yes, we talked to our speakers bureau and are going to have offline and online. Okay, we will project it in a projector if online trainings.
we will still be presenting through
Yes.
online, Mama. And one of the suggestions for the benefit of the leaders is that we can also
Yeah.
project it during the in the office in the branches for
Yeah.
you to still appreciate our trainings
But of
because we
course,
will be having trainings with the VPs with the training team, and every now and then we will be conducting different kinds of trainings for you. Of course, every time we talk about the products, that will be my part.
yes, go God. Yes, let's go back to this a question of Alio. All right, from Niger, a product. What product to give against sickle cell anemia? Sickle cell
Oh,
anemia.
okay. As what I've always mentioned in my lectures, as long as we're talking about the blood, either bleeding or bleeding tendencies like anemia, leukemia, sickle cell is still anemia. That is only present in Africa, of course. The reason why it's called sickle is because the hemoglobin is no longer rounded. It is shaped like a sickle. Okay. Now, for those suffering from problems of the cardiovascular, okay, then the product I will be recommending will still be complete phytoenergizer. Again, initially started one. Try to increase the dosage every now and then. And it will be better if after 3 weeks you'll be having a repeat of your CBC or test being done by the doctors to confirm the sickle cell in order for us to note if the hemoglobin somehow is also improving. Okay, but about the products, you go for complete or even my choco or even of course ultra H2 if you have it.
All right, thank you, Doc. Another question from Onos. How about for the eye problems like cataract? Cataract.
Cataract, there's only but one remedy, especially if it's a mature cataract, that will be a surgical operation. They will remove it, cataract extraction, and they will replace it with an artificial lens, and that will be good. But while we're waiting for the procedure to happen, okay, initially I will be suggesting Colidus, Restore Life, and C24/7. But remember this: a week before the operation, remove products with resveratrol and even Colidus. Because remember, they have a blood thinning effect that may possibly cause bleeding. Okay? Now, 1 week before the operation, you shift to complete. Then after the operation, as long as you can already eat a solid food, you may resume again with complete. Doctor, when can I start taking again the other products? 1 month after the operation, you can now take again Colidus, Restore Life, and C24/7. You get me? Okay. What else?
All right. Who else has a question? This is your right time for you to ask questions because some of you are bothering us around 12 in the midnight asking these questions. So this is the right time for you to ask
But Brother
questions.
Jeff, if I were them, take a snap of these slides, okay?
Yes, yes.
So that
All
you'll be
right.
able to know how to properly give the products of the company and when to avoid it and when to give it properly. Okay.
Mm. Okay, so okay, everyone, please don't forget to take a snap this slides that are showing in your screen. This is very important. Okay.
But
Then
I
we
know,
have also,
partner, in our seminar rooms, Brother Jobs, these are posted, right?
yes, 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 doc. Yes, doc.
So
Okay.
once they go
Especially
back
in
to the
our
front,
inside. Yeah.
they can be able to see these slides. Okay.
All right. Mama Grace told me. Yes. Yes. From Catherine, what product is best for a pregnant woman during labor to alleviate pain? What do
Ah,
you mean? What
nothing
do you
can
mean?
alleviate the pain. Okay, it's really painful. Okay, because you would like it to happen through natural means. Okay, so again, for a pregnant lady about to give birth, I'll only go for complete phyto energizer. Okay, but I would like to inform you the pain will still be there because that's part of pregnancy. That's part of giving birth. Okay,
Yes,
uh,
yes.
for you to to for you to heal faster, then you go for complete phyto energizer.
Mm. Yeah, we have another question, Doc, but I know the product that this person is asking is not yet in Nigeria, but of course, some of our leaders, some of our leaders are also buying from their uplines, okay, shipping to
Okay.
the Nigeria. But of course, for everyone, Doc is 14 years old, allowed to use perfect white.
What age? 14? 1 4?
Yes, one four, one
No, no,
four.
no, no. The product Perfect White and White Light will only be recommended for 18 years old and above. Okay? Just like what I
Yeah.
mentioned, 1 year old, my Choco. 2 years old, Kitty 24/7. 12 years old, complete Colidus. 18 years old for the rest of the products.
Yes. But to all the new distributors here, again, Perfect White is not yet here in Nigeria, but some of our leaders bought from Philippines. And of course, they are asking for the dosage of it.
Able to purchase because of their uplines.
Yes.
Eh,
Hemorrhoids, doc. There's a very wonderful
Hemorrhoid.
question.
They call it as piles in Nigeria. That's the pile. Now, there are two kinds of hemorrhoids, the internal hemorrhoids and the external hemorrhoids. The ones that usually leads to bleeding is the internal hemorrhoids. So let's make it simple again. Um, if there will be a bleeding, then just go with complete. But if there will be no bleeding, okay, you can take C24, Restore Life, and even Colidus once it's already available there. Now, another suggestion: eat fruits and vegetables in order to in order for your stool to become bulky so that you will be able to defecate easily. And in the morning, make it a habit that when you wake up, drink a warm water, eat a hot food or hot meal. Then after eating, relax for approximately 10 to 15 minutes until you will be able to feel the urge to defecate. And do not try to strain while defecating because those are some of the reasons why you will be developing hemorrhoids. Okay, relax, let it take its natural course, but do not strain while you are moving your bowel. Clear? So you go for complete without with bleeding. Without bleeding, you go for C247 for rest of your life colidus. Okay?
Right. So take note on that dosage and specific product, Mr. Alio El Hadji Ada. And from Adisola, what products will be suitable to treat typhoid fever?
Of course, there will be antibiotics that we give to clients suffering from typhoid, like ciprofloxacin or cefuroxime or cefixime. Those are the antibiotics we usually give. Now, remember, we are only here to supplement the synthetic medications. So for typhoid fever, I'll go for complete. But
Complete.
that is not the primary medication. It's a supplement that will try to help, okay, the antibiotics that will be given by your doctors. Oh.
Hey, yes. Thank you, Doc. And another question from Mr. David Young. Okay, this is related with the liver problem, hepatitis C.
Oh,
See?
oh, 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 okay.
Hepatitis.
There are five kinds of hepatitis: A, B, C, D, E. The A and E are said to be fecal oral from the food, okay, that you're eating. That's A and E. A is self-limiting, but for the B, C, and D, it's the one transferred through blood, okay, sexual intercourse, or from mom to the baby. Okay, now it's lifetime. The virus will be in your body for the rest of your life. Although the ones we're trying to hope is for the titer to go down. Now, for Hepa B, aside from the medications that will be given by your doctor, we have the so-called suffix that that should be taken for at least 1 year to 2 years. Okay, we can add. You have to be sure that your SGPT will be normal. Okay. But again, when every time we deal with kidney and liver problems, we go for a complete phyto energizer. Okay, so go for a complete. Maximum will only be 1, 1, 1. That's the maximum. Start with once a day.
Yes. Right. Okay. Okay. Who else has a questions? All right. Don't be shy now. uh, Burn Slim. What's the best? What BP are you talking? Yes. Please, is Burn Slim in Nigeria? Yes, you have Burn Slim now.
Yeah.
They are
You may
asking.
take it once a day. Every week you add one. 3 times a day will be the maximum for burn slim. It should be
Ah,
taken 30 minutes before mealtime
and talking
for you
about
to
burn
start.
products, yes,
Hmm,
yes. And talking about burn products, there will be upcoming new product. Okay, be watch out for that. Watch
that's
out
good.
for that. Another burn product.
Nice.
Okay, what's the best? What do you mean, Sabina? Please, what's the best combination for BP? What do you
Blood
mean?
pressure. Maybe she's talking about the blood
Blood
pressure.
pressure. For
Yeah,
high
high blood
blood
pressure.
pressure, I think.
Okay. This is it. Um, the simple question is, are they taking blood thinning synthetic medications like this or not? So every time we talk about cardiovascular diseases, remember this: heart attack, stroke, hypertension, diabetes. Ask the client. That's why you have to have this a copy of this slide. Okay, so take a snap. If they are taking blood thinning synthetic medications like aspirin and clopidogrel, then you can recommend complete and Colidus once a day. For complete, you can go as much as 222, but begin with once a day. If they are not taking blood thinning synthetic medicines, you can go for a combination of these three wonderful products: Restore Life C24/7 and Colidus. Together with the antihypertensive medications given by your doctor like losartan, amlodipine, lisinopril, and so on and so forth. Okay, I'm sorry. Uh, Losartan, amlodipine, what are the other medications? Metoprolol, not lisinopril, metoprolol, and the other medications.
All right. So that's best dosage for high blood pressure. And of course, we also have a question from our live video. What should be given to someone suffering from gastritis? Okay.
Gastritis or ulceration or dyspepsia. Okay, so again, aside from the medicines that will be given by your doctor, like omeprazole or ranitidine or aluminum magnesium hydroxide or Malox, okay, the ones I will be preferring will be C24/7, 2 hours after meal. Okay, and definitely you have to go for a small frequent feeding. You have to eat at least 4 times to 5 times every day. Small, small, not the amount of food that I usually see for African leaders when they when they eat. So make it small, small only. Okay, small, frequent. Drink lots of water. Don't drink colored drinks. when you're suffering from gastritis, just go for plain and simple water. Small frequent ones, then of course you can give C24/7. Okay?
All right. That's great. Okay, from Eke Joshua, you are looking for the healing book available in Nigeria, the Book of Doc Butch.
There.
Yes,
You're
we
so
still
lucky
have
because there are only
plenty.
two countries wherein that book is available, and that's the Philippines and Nigeria. Okay.
We still have in Onitsha, brother. Just call
Yeah.
Mr. Felix or ask Mr. Felix there, our RC head.
You can be able to enjoy and reading the book. You can appreciate the importance of taking food supplements, why food supplements, and the basic products of the company. Of course, is part of the book. So grab a copy until supply lasts. Here in the Philippines, I guess we don't have the book anymore, or there's only a few remaining. In Nigeria, there's still a copy.
Yeah, we still have a plenty of copy. Okay, and from Saint Arnold. Wow, what a beautiful name, Saint Arnold. I didn't regarding about for medication or therapy for rhinosinusitis.
Okay. Rhinosinusitis usually is allergic in nature, or sometimes um, viral infection also is common. So for sure, doctors will be giving you chlorpheniramine, okay, or we have these so-called different medications there. I forget the ones I usually take in Nigeria. Is it called Rex, if I'm not mistaken? Okay. So aside from those medications given by your doctor, I'll go for C24/7 and Colidus. Okay. You can go for those products.
Okay. From Fanny Teku, can a kidney disease patient take Liven coffee? Burn. Burn.
Well,
Why burn? We
again,
don't have
why?
burn
Why?
here.
You would like to lose weight? No.
Liven
Um,
coffee burn. We don't
um,
have yet burn here.
my dear leader, brother, for kidney diseases, I will only be recommending complete. Okay, and it will only be with a maximum of 111. I will not be suggesting the other products yet because once the kidney is damaged permanently, especially, we need to take care of it. That's why sometimes you need to undergo dialysis, depending on the severity of the kidney problem. But don't give the other products yet. You may start with complete if you want. Okay, but not especially not the live and burn. Okay.
Thank you, Doc. Doc, regarding with the gastritis a while ago,
Yeah,
they are asking if they can take natural juice.
I don't think so because it will still be acidic.
Still, all
Just
right.
water. The
Just
best
water.
liquid that you can drink if you're acidic will be water.
Yes, Mr. Sister Ilvestor, yeah, water. If you have Ultra H2, much better, right?
Yeah.
Take Ultra
You can
H2.
borrow the Ultra H2 of Mama Grace if you're leaving the Abuja.
Yes, I have also here Ultra H2. You can borrow. Okay. Any more questions here? Okay. At least already answered all the questions here inside. Already answered. Are we still okay? Two more questions. Two more questions.
Sure.
Well, we're okay. Yes, yes. I guess some of the leaders here are already excited to waiting for the next 5 days because by October 1, those people, those leaders who are in prime position can enjoy the UPP from first level up to the 20th level.
Wow.
Right?
Wow.
So I advise everyone for you to achieve the prime position, products is the answer. Okay? Products is the answer.
Mama Grace, go for the GA Prime. Okay.
There's no wahala from Mama Grazo. Left and
Uh,
right, Okoli and Elias. So. More wahala.
Oh, wahala, oh. But Mama Grace, you must have a direct, okay,
Yeah.
a silver executive direct prime in order for you to avail of the GA prime.
Yeah, they
Okay.
can't wait for October 1. Out of
And
30.
once you have the SE prime, that will be good for 3 months, right? Is that right, Brother Japs, if I'm not mistaken? Okay.
The what, Doc?
For Mama Grace GA prime, if she has a SE prime, then that will be an
Yeah,
extension of
J8
three
pa.
months. Wow.
Yeah, they are waiting for the logo in their DTC.
Mama Grace, I will assure you, even the pairing will be bagam bagam bagam.
All right. Okay,
Okay.
Doc, we have a question. A patient with kidney failure took full up to 2 months, but so far his creatinine is only 2 milligrams per deciliter. Hi, what should we do?
If 2 milligrams per deciliter, that's so low. Wait a minute. 1.1, 11. 1.1 is the normal, so that will still be high.
Yeah,
If,
too
if,
high.
if I'm not mistaken, if I'm not mistaken. Okay, so still go for, I will still go for complete, regardless. I will still prefer complete, okay, rather
Okay,
than the other products.
complete. Okay. Is there any more questions here before we end our discussion? Okay, 10 seconds. 10, 9, 8, 7, 6,
You're
5,
just
4.
giving a countdown.
And probably they are already excited to do
Yeah.
their activities after this. Yes, they are all excited. Okay, because Nigerians are very competitive. Okay, you know what? To all other people who are watching here, distributors in other countries, we have already GA primes within 2 days and finished their first 500 pairs
And
within
that
two
will be so
days.
easy for Mama. Okay,
Yeah,
the first 500 or 800 pairs, brother.
500 here in
Ah,
Africa.
really?
500. Yeah, only 500 pairs. Then after that, 1818 cycle at 6,500 naira. All right. Where's Doc Butch? Oh, what happened to Doc Butch? Doc Butch left the room. Dr. Butch. Okay. Wait, I will call Doc Butch. Anyway, so I guess everyone learned from our product training by our product specialist and medical specialist, Dr. Butch Villena. So this is very important knowledge that we have you been, Doc? You left the room. You were asked.
Sorry for that. It's a mistake.
Maybe you end the presentation. Anyway,
I was trying to
okay.
end the presentation, but I
End the meeting. You leave the meeting. Anyway, thank you so much for everyone. Okay, for all the people who participated here in our Zoom and of course in our live. Thank you so much. We appreciate your effort despite of these technical problems. I know once we are experiencing rain here in Nigeria, everything is affected, especially our internet. Okay, so
brother,
yes.
number one, again for the leaders of AIM Global Nigeria, thank you very much for attending the training. Number two, if you haven't gotten your NPP yet, it's about time for you to do so, especially for you to appreciate and enjoy the EdPlan 2.0 that was given and presented by the company to our great leaders in Nigeria. Again, I will assure you that once
Yes.
you see your DTC, especially on the 15th, you will be surprised about these wonderful additional benefits given, okay, to our marketing plan. Okay, and that will be the UPP. Okay, and
Yeah.
even the pairing, you will benefit, especially if you have the SE Prime, GA Prime, and